Hey, welcome back to SA Live. It is August, and there's a man in a white coat. There's a man in a white coat here, so you can trust him. He's a doctor. Doctor is here in making buckhorn calls, right? Dr.
Yes,
Casey
sir.
Tabor.
Yes, sir.
He's here. We're going to talk a little bit about safety from the Sports Institute at the San Antonio Orthopedic Group. And going back to school, kids are active and playing sports, and we got to take care of what first? The first thing you put out there, right?
Well, we'll start with one of the things that's gotten a lot of publicity lately is the concussion. So with Texas, South, big football state. Concussions have gotten a lot of publicity because of the safety of our kids. And so, you know, one of the things that they do to try and protect them is they do some special things to the helmets. This is an old helmet from long time ago, but you can see they have these air cushions in here. They're blown up to fit the person. They have a little nozzle there where you blow them up, and that's and that's a good school right there.
Why is that? I don't understand.
Why is that?
I don't understand.
They're just national contenders, baby.
Oh, is that how it works?
Yeah, that's
okay.
good.
I'm sorry, I didn't. What does that stand for? LSU. I'm not lose some.
Something
ultimately.
Like that. I'm not really sure.
I'm giving him a hard time. Dr. Tabor knows his stuff. Yes, so that's a good example of what to have for a kid to have reinforced helmets like that.
And that's mandatory. Some of the other things with the concussions is really recognition. The kids, rarely do they lose consciousness. It's usually a stinger. We used to call them stingers. Or I got my bell rung. Those are concussions, and those kids need to come out. And the rules nowadays have really come down hard. Those kids sit out. They have to be cleared by a licensed physician.
There you go.
They're not just cleared by their coaches. Most of the trainers are updated on concussion protocols, and so those are things that you need to recognize as a parent. If your kid's having problems with concentration, dizziness, headaches, those are like mild symptoms, but they're real.
I mean, you can even judge by the dilation of the eyes.
Absolutely.
Right?
Those are usually a little bit more significant, but absolutely.
So a little personality click thing that maybe they don't feel well, appetite, those kind of things too.
Correct.
And just ask questions about how
you know all about that.
I
right?
do. I think I'm having a concussion now. I'm not
That's
sure.
the heat.
I'm not. Oh, it is.
Yeah.
Yes. Exhaustion.
Yeah.
Well, let's talk a little bit about that. How does that work? We want to protect people from the 112-degree temperature.
Well, so number one, you want to hydrate. You know, the sports drinks that we use, all of the Gatorades, the different sports drinks, there's Powerade. Those are things you want to do before practice, during practice, after practice. And that is super important. And you talk about heat strokes. This is, 106 degrees today, 104 degrees. It gets very hot very quickly.
And some of the symptoms, high body temperature, we're talking about, profuse sweating. You can get into, headache and dizziness and muscle cramps, and even looking at, when you have dark urine.
Right.
Yeah.
Right. So there's heat stroke is a little bit more serious. That's when you get your core temperature greater than 104 degrees and you can't bring it down.
Okay.
And so the key is not to ever get to that point.
Right.
And so there's a couple of things that we do out on the field, and we do it down in the bayou a lot where it's 104, 106 degrees and 100% humidity. And these are these ice baths that we do.
Okay.
Have you ever seen that happen?
No, I've never had that happen before, but I do know when a child gets a fever, you can put them in cold water or use a cold
bring
rag.
The core temperature
The
down.
core temperature is key to the whole scenario.
Absolutely.
Okay.
So if you're willing and able, I'll show you what that's all about.
What do you mean?
I'll cool you down. You look like you're a little bit feeble right now.
Okay, what do you want me to do?
Sweating. Now, what I want you to do, I want you to relax.
Okay.
I want you to close your eyes. I want you to just kind of bend over.
Just bend down?
Yeah, just kind of down like that. Close your eyes.
Okay, so if you're having, heat, exhaustion, or you're feeling, it's good to get a breath, obviously. And do I close my eyes?
You close your eyes.
Close your eyes.
Close your eyes.
You close your eyes.
And you just...
Hold on. Whoa, dude, Doc.
Then you drape that over your head a little bit. That'll bring your core down real quick.
Yeah, I think it did. How many degrees? Probably 17.
Something like that.
Dude, a couple of degrees will help. I appreciate you doing that. I didn't expect that, though. That's what I was going to say. All right, to contact the Sports Institute at the San Antonio Orthopedic Group, give them a call at 210-804-5400. You're out of control. Can I borrow that robe?
Yeah, absolutely.
that jacket. Or you can go online to tsaog.com. All right, thanks. Thanks, Doc. Wow, that's cold. I tell you. And it just keeps going.
Drape it over you, too.
Well, no, we're not yet. We wouldn't do that. I'll change into something more comfortable. We'll tell you about boat owners that are making a difference and waking the world, literally, here in our own backyard. And Ben & Jerry's will be right back. We'll talk about their new flavors that they want you to vote on coming up on SA Live.